Understanding the process of angiogenesis has created a number of therapeutic targets for us. We know the dominant initial factor, and a factor that's present mainly throughout the life cycle of the cancer, is VEGF, or vascular endothelial growth factor. That's the ligand for the VEGF receptors. There are 3 known receptors. Primarily it's VEGF receptor 2. That's the driving pro-angiogenic receptor on endothelial cells. Tumors will secrete VEGF to induce angiogenesis. So one target of anti-angiogenic therapy is the VEGF ligand, which is the target of bevacizumab. So bevacizumab is a monoclonal antibody that binds various isoforms of the VEGF ligand and prevents ligand receptor interaction, thereby decreasing or inhibiting angiogenesis. Another strategy is to direct the monoclonal antibody to the VEGF receptor 2. And in fact, that's been a successful strategy with ramucirumab, where we saw in the REVEL trial the addition of ramucirumab to docetaxel improved response, progression-free survival, as well as overall survival, and led to the approval of ramucirumab in the second-line setting in combination with docetaxel. One of the areas a decade or so ago that was of great interest was the use of vascular endothelial receptor tyrosine kinase inhibitors, all the IB drugs, as I refer to them, as sunitinib and pazopanib and sorafenib, and that class of drugs. These are orally administered small molecules. They inhibit the kinase domain of the vascular endothelial growth factor. Although they're not specific, they do have other targets such as PDGF, RET in certain cases, and others. So they're a bit more promiscuous than the monoclonal antibodies, which have a much higher degree of specificity. And even though this class of drugs, almost all of them have been tested in lung cancer, all of them have some low level of activity, but they have not yet passed the phase 3 test where they've led to improved survival outcomes. And therefore, we don't typically use them nowadays because we don't have any FDA approvals for these drugs, despite the fact that they do have a level of activity in this particular setting.